Okay, so we're going to be back here today for the second part of Chapter 1's lecture, which is going to be just anatomical terminology. As you can see, my video is a little bit slow. So I'm going to go ahead and turn off my camera until I need it. I'm going to need it for when we go through some of the directional terms. So I'll turn it off for now, so that way then it speeds things up a little bit. So really quickly, we're just gonna today kind of be going through the different anatomical terms. We're gonna go through the regions of the body. We're gonna go through the body cavities, and then we'll go through the anatomical planes and sections, and then how we use our directional terms to reference different parts of the anatomy. Now, when we talk about the human body and reference it, we're always going to be referencing it in anatomy in both Bio 201 and 202 from anatomical position. So anatomical position will always be body erect, feet flat on the floor, slightly apart, arms at the sides. Everything's pretty easy so far, right? But then this is the trick. Palms facing forward with thumbs pointing away from the body. Okay, so this is a little bit hard for most students to picture because this isn't like how you're not like walking around like this, right? With your like palms facing forward. So this is something that you really want to kind of get ingrained in your mind early on, because any type of anatomical reference that we do in this class will always be from anatomical position. So when we talk about things being anterior, more towards the front of the body versus posterior towards the back of the body, you're going to have to remember that your palms are going to be anterior. They're going to be facing forward, okay? We're going to talk about things being medial towards the midline and then lateral away from the midline. So you're going to look at your thumbs here, and they're going to be more lateral than your pinky, because your pinky is going to be closer to the midline. So again, when we make these references, we're always going to be doing it from anatomical position. So again, remember that it's going to be palms facing forward with thumbs pointing away from the body. Underline this, circle it, highlight it, whatever you need to do to make sure that you know that, because it may be the difference between you missing a point and getting that point. Because if you don't know anatomical position, you might know the reference, but if you don't know anatomical position, then you don't know the reference in the correct position on the body. So make sure you know that. Just a couple reclining positions. Prone position is if your body's laying face down. This is how my husband likes to pass out on the bed, so I always remember that as prone position. And then supine position is just going to be, again, with your body lying face up, kind of like you're on, you're getting some dental work. This reminds me of you. So you also probably remember the term proning from some of the more severe COVID patients. They had to do this to help kind of keep the fluid in the lungs from like settling too much in one area. So they would, again, put the person in a prone position for a period of time. So that's called proning. So you might know that term just from that, from COVID. Okay, let's get into some directional terms. And again, I'm going to try to go through this pretty quickly, but if you have questions and I'm going through this too quick for you, again, please reach out to me and I will set up some time to meet with you and we can spend more time on this for sure. So again, remember that when we use these directional terms, it's always going to be from anatomical position. And then remember that right and left are going to refer to the body being viewed, not right and left on you, the observer, okay? So I always like to tell students, remember, it's not about you, it's about your patients, not about you, okay? So it's going to be your patient's right, your patient's left, not your right and left, about the patient. So when you are using some directional terms, a couple that we're going to use are going to be superior and inferior. You can probably figure these out already, but we're going to go over them. We're going to use proximal and distal when it comes to limbs, and medial and lateral when it comes to the trunk of the body. So again, we'll go over all of these terms now. And then we're also going to use, when we refer to the front versus the back, either dorsal or ventral, or posterior, anterior. Okay, so I'm going to explain what these terms are really quickly, and then this one's a little confusing because we use both terms. So anterior and posterior are primarily used with human anatomy and physiology. Dorsal and ventral are primarily used when we're talking about other animals, but it creeps back in because some of these terms came initially from and were named initially from when we found them in animals. We've kind of kept that. So you're going to see that your anatomy book will go back and forth between using anterior, posterior, dorsal, ventral synonymously. Okay, so let's first talk about anterior. Anterior means at the front of the body. Okay, so you can also use this as ventral. Ventral typically means belly side, okay? So anterior or ventral will be used kind of synonymously. You're gonna see that we're gonna use anterior more because that's specific, again, to human anatomy physiology. But it will go, especially when we get to the nervous system, you're gonna see ventral slip into a few of the terms, okay? So just keep in mind, this is anterior or ventral, and then dorsal or posterior is towards the back, okay? The back of the body. So dorsal or posterior. So those are going to be the terms that, again, you're going to be responsible for knowing. So you really want to get comfortable with these. These ones are easy. Well, at least especially medial. Medial just means towards the midline of the body because we have bilateral symmetry, right? So you have this midline that you could kind of dissect the body and it's kind of a mirror image on each side. So medial means towards the midline, and then the lateral is going to mean away from the midline, okay? So pretty easy, right? Medial towards midline, lateral away from the midline. And just to give you an idea of how you might use these terms, you would use this in terms of like the heart here and then the lungs on the side. So you would say that the heart lies medial to the lungs and that the lungs lie lateral to the heart. Okay? So hopefully that kind of helps you. Oh, this is a good one with the thumb, right? So remember that we're always talking about things from anatomical position with the palms facing forward, thumbs out. So the thumb is on the lateral side of your hand and your pinky finger is on the more medial side of your hand, okay? So again, just to kind of bring the hand back in there. Now with our limbs, because again, they attach to the trunk of the body, we're going to use the terms proximal and distal as well. So proximal and distal are primarily used for the limbs. And proximal is going to mean near or closer to the attachment of that limb to the trunk of the body. And then distal, you can think of as distant. It's farther from the attachment of the limb to the trunk. So what we like to tell students, think of proximal as it's closer in proximity to the trunk of the body. So proximal, closer in proximity here. And then distal is more distant from the trunk of the body, okay? So for example, if you're looking at, your knee and your ankle in comparison, your knee is going to be more proximal than your ankle is, and your ankle will be more distal than your knee, okay? You can do the same thing with the wrist and the elbow, right? So the wrist is going to be more distal to the elbow, and the elbow is going to be more proximal than the wrist. So again, when we use these directional terms, we're usually referencing two different parts of the body in comparison to each other. Okay? So again, make sure that you get really comfortable with these terms. And then the last two terms, which I didn't have a separate slide on, are superior and inferior. Again, we'll also sometimes slip in the terms cranial and caudal, but mostly superior and inferior. So again, superior means towards the head, again, or the cranium here. So that's why we use that term cranial. And then inferior is going to be away from the head, right, towards the lower part of the body. And that's why we use caudal, because if, we had a tail, we've got a tailbone, right, then it will be closer towards the tail end of the body. But obviously, that term caudal comes from animals, from when we did that comparative anatomy with animals, because if you're looking at a dog, right, their tail is at the kind of end of their body, where here obviously again our feet would be the most inferior portion of our body. So again, you're going to hear inferior, superior used much more commonly, but you'll see cranial slips in there. Caudal not so much, but cranial does. Okay, so again, the example here is the head is superior to the abdomen, and then, the abdomen would be inferior to the head. So just to give you an idea, again, of how those terms work. So you can look through this chart. This chart's kind of nice, and it gives you some more examples, again, of how those directional terms are used. You do want to make sure that you know all of these directional terms, again, not only just for lecture purposes, but also for lab. And then you're going to see that we also use superficial and deep. Superficial, of course, means towards the surface of the body, and then deep means more internal, okay? So those ones are pretty easy. Now, when we talk about regional terms, this is going to be used in terms of how we divide up the body. And again, we do this primarily for us in terms of how we learn. So when we talk about the skeleton, we're going to talk about the axial skeleton. And so the axial skeleton will include the head, the neck, and the trunk of the body, okay? And then the appendicular skeleton is going to include the limbs, okay? And the girdle, so your arms and legs, and then the girdles that attach them to the actual axial skeleton, like the pectoral girdle up here and then the pelvic girdle down here, okay? So just introduction to that. We're gonna use those terms, axial and appendicular. You'll see them more in the skeletal lectures, so we'll get to those when we get to the skeletal lecture. And then we also have these terms that you can kind of just briefly get familiar with these terms. So that way then this will help you all throughout anatomy. If you get to know these terms now, then they will really help you in terms of doing some of the memorization for the lab, because you're going to see a lot of the lab terms are going to be named after these areas. Like you're going to have, again, nerves, you're going to have blood vessels that are going to use the term axillary, referring to anything that's in the armpit region, okay? So make sure that you kind of get familiar with these terms. I mean, I'll only put like probably 2 or 3 questions, 2 questions probably at most, using these terms on the first exam. But like I said, if you can get familiar with these terms now, then it will make life so much easier for you. So let me really quick go through some of these terms. Here's the cephalic end. A frontal region is just referring to the forehead. That's pretty easy. Orbital, referring to like the eye orbit. Okay. Nasal, easy nose. Oral, mouth. Mental, you're going to see when we talk about the mental foramen in the skull, that'll make sense. But this is referring to the chin region here. Cervical, of course, refers to the neck. When you talk about the thoracic region, the thoracic region is going to be your chest region, anything really where the diaphragm runs here, anything above the chest. So this is going to include, when you say the thoracic region, things like the heart and the lungs, okay? And then obviously any of the structures that protect the heart and the lungs. So we're going to have the sternal region, which is going to be part of, again, your right where your sternum is. And you guys probably know where your breastbone is. Your sternum. Then again, you have your axillary regions, which is going to be right underneath your armpit. And then of course your mammary region here, which will be, again, that area around the breast. When we go talk about the abdominal region, umbilical is a term that we'll use that obviously goes right around your belly button. Pelvic region, we'll talk about the pelvic region as being that area that includes, and I'll get to this in a minute when we talk about the abdominal cavity, including all of these digestive organs. And then the pelvic region is going to include things like your urinary bladder and then your reproductive organs. So then inguinal is a term that you want to get to know as well, because you're going to see we're going to name blood vessels and nerves after this. So inguinal is going to refer to the groin region. So what you call the groin in anatomy, we call the inguinal region. Pubic, again, is going to oftentimes refer to genitals. The upper limb, we're going to talk about kind of the shoulder region as the acromial region. The upper arm, we're going to use the term brachial. Antecubital is going to be right in front of your elbow, that region right in front of your elbow, the forearm region right on the other side of your elbow. And we use that term sorry, not your forearm region, but on that same side, but it's going to just be that region right in front of your elbow where it forms that crease. And there is going to be some blood vessels that we name after that region where you actually are great for drawing blood. So you want to know the antecubital term. Antebrachial is going to be the forearm region. Carpal will be your wrist. And then when we talk about the hand, we're going to talk about, obviously, the palmar region would be your palm. The pollex is going to be your thumb. And then all the other fingers are going to be your digits. Okay, so here you've got digit 1, 2, 3, and 4. And then here's your pollex, your thumb. Okay. So lower limbs, we're going to talk about the coxal region is going to be your hip. Femoral region will be your thigh. Patellar region is going to be like your knee, basically, on the, again, anterior side. Crural is going to be this front portion of your leg. You're going to see we're going to call the back portion where the calf is your sural area, but this is crural. And then the fibular region is going to be right on the kind of side, the outside there, where the kind of fibula runs, and we'll get into that in the skeleton. Pedal is going to include the tarsal, which includes the ankle, and then your metatarsal region right up here, and then, of course, you have your digits, 1, 2, 3, and 4, and then that first one, your big toe, is going to be called the hallux. Okay. So again, just some terms to know. Again, looking at the posterior or dorsal side here. So this was all the anterior stuff that we just went over. Now we're going to go through the posterior or dorsal back side of things. And again, we have the cephalic region. Here you can see otic is the term we use for your ears. Occipital, you'll see we'll use this when we get to the skull, talking about this region, the lower back of the head. Cervical, again, is still the neck. Scapular is going to be obviously where your scapula is here in your upper back. Vertebral along the vertebra. Lumbar is going to be this lower back region. Sacral region is going to be this area kind of in between your lumbar region and your gluteal region here. So there's sacral region in the center here, where your sacrum, literally where your sacrum is. And then here's your gluteal region. Oops, sorry about that. Let me go back. Perineal region is going to be the area. This is a term you want to know because we'll use this, especially when you get into 202. It's going to be between the anus and the external genitalia. So the area between the actual anal opening, the anus, and your external genitalia is the perineal region, in case you've ever wondered like what they were referring to when they said that. Again, upper limb, some of the same terms: acromial shoulder, brachial upper arm. In the back, instead of antecubital now, which was in the front, right, in the anterior, in the back or posterior, we're going to call this the olecranon region, and that's because this is going to be the olecranon process that's going to make up your elbow. So, and then here again is the antebrachial forearm region, so we still call that antebrachial. So the brachial and then antebrachial stay the same, okay? So that helps a little bit less, right? And again, some of these terms are all the same. Let's go to the lower limb here, where again, the terms are a little bit different from the front. So this is still the femoral region because again, the femur runs here. But now, again, when we talked about the front here, we had the patellar region. Oops, sorry, I'm going back to the front here. We had the patellar region and the crural region here. So now in the back here, we have the popliteal region, which is, again, just in that crease right behind the knee here. And then the sural region, which is where your calf is. Okay. Calcaneal just refers to your heel. That's because of the bone that forms your heel. And then here, plantar just refers to the bottom of the foot here. Okay, so plantar. Okay, so just again, a couple terms to get familiar with. Just go through those terms a few times and just make sure that you're familiar with them. I'm not going to test you on the spelling of them or anything like that. But it will help you to know these terms for both lecture and lab. So just get familiar with them now. Okay. Let's talk about planes and sections. So planes are these imaginary, again, flat surfaces that we use to divide the body up and then separate, organs into different areas. So our three most common planes are going to be the sagittal plane. The sagittal plane is going to cut the body into left and right halves, or left and right parts, because it doesn't necessarily have to be right down the midline. We'll talk about that in just a minute. The frontal plane or coronal plane right here is going to separate the body into front and back, or anterior and posterior. And then the transverse plane right here is going to separate the body into superior and inferior parts. Okay, so we use these flat surfaces to kind of cut the body, and then we actually will name cuts off of them, especially when you're talking about looking at like an MRI, so you know what type of section you're looking at, what type of cut was made when you're looking at that MRI section. So again, just like we talked about, the sagittal plane is going to cut down the midline of the body, and it again divides the body into these kind of vertically left and right parts. And mid-sagittal plane will be a cut right down the midline, and then parasagittal would be if you cut off center. So for example here, this is a mid-sagittal cut dividing the body into equal left and right halves here, but you can sometimes have a parasagittal cut where again you're dividing the body into equal left and right halves because it's off center. Okay, so that's all that means. So there's mid-sagittal and parasagittal. Then we have, again, our frontal plane, which remember is going to divide the body into, I'm just going to use this diagram because I think it's easier. So again, the frontal plane is going to be that cut, also called the coronal plane, because you'll see when we get to the skull, that term will make a lot more sense. But the coronal plane is going to divide your body into anterior or ventral. Remember, that can mean the same thing, the front side or belly side. And then posterior dorsal, okay? So that's what the, the frontal or coronal plane is going to do. And then again, transverse, dividing it into superior and inferior halves, okay? So I think, lastly, we have an oblique section, and that is going to result from any cut that's at an angle other than 90 degrees to the vertical plane. So if you have, like, instead of a transverse section, again, it's a different transverse section is going to be a horizontal line, 90 degrees to like the vertical plane. So transverse section is going to be straight across, where an oblique section will go kind of at an angle like that. Okay. And I don't even know, do they have an oblique section on this? They do. Oh, here's an oblique section, So a transverse section would be straight across, and then an oblique section at an angle here. We don't really use oblique sections very often, so I'm not going to emphasize that one as much, but you can see that, here are some MRI images, and it's important to know what you're looking at. So it's important to know that, here you're looking at a mid-sagittal cut here. Here, it's important to know that you're looking at a coronal frontal plane cut here, and here a transverse cut. So you're like looking into the lower half of the body here. So it's really important to know what your cut is. It's also important to understand the different body cavities or spaces within the body. So we're going to name those different body cavities. And the reason that we learn these body cavities is because, again, these body cavities are enclosed internally and cut off kind of from the direct outside world, okay? So when we look at our body cavities, first we can break up the body cavities into the dorsal body cavities. See, and I told you, here's where they flip-flop, right? So they don't always use posterior. In this case, they use the dorsal body cavities, and the dorsal body cavities are going to be towards the back. So the dorsal body cavities are in yellow here. And then the ventral body cavities are going to be all towards the front or in red here. Okay, so we break up the dorsal body cavities into the cranial cavity, which makes sense, right? It's the cranial region. It includes the brain. So that's the cranial cavity, includes the brain. And then, of course, here is the vertebral cavity, or also called the spinal cavity sometimes, and that's because it includes the spinal cord. So those are the two dorsal cavities. That's it. Cranial cavity and vertebral cavity. Now, when we look at the ventral cavities that are going to be, again, more towards the anterior front here, we're going to break this up into first the thoracic cavity and then the abdominopelvic cavity, okay? The thoracic cavity is going to be your chest cavity. Again, it's going to be anything that is going to be above what we call our diaphragm, our big breathing muscle there, right? And so this is going to be stuff like the thoracic cavity. That's going to include the heart and the lungs. Now we're going to talk about cavities within these in just a minute, but I don't want to get into these just yet because it makes this look like the pleural cavity is just the lungs themselves. This is a little bit different because this is actually a cavity within a double membrane lining of the lungs. So I think that this diagram here is a little bit confusing because I think that students get this a little bit confused. And on each exam, I almost always, and sometimes I get this on the practicals, I would always get answers for this cavity, like pointing here, being something like the pleural cavity for the lungs, or again, the pericardial cavity. But the thoracic cavity actually includes all of these, okay? So it's a little bit confusing. And I'm going to go through what the pleural cavity and pericardial cavity are in just a minute. But again, I think that's really a confusing diagram, and you'll find out why in just a minute. So again, the thoracic cavity is going to be that big cavity underneath the ribs. That's going to include the heart and the lungs, okay? And then it's going to be separated from the abdominopelvic cavity, which is going to include all of the abdominal and pelvic organs. Now we can take the abdominopelvic cavity and split it up into the abdominal cavity and then the pelvic cavity. And it's easy just to remember that the abdominal cavity is going to be all of our digestive organs, our digestive, what we call viscera. Viscera means organs. So here's all of our digestive organs, and here's all of our pelvic organs. Now, our pelvic organs are basically going to be your bladder, your urinary bladder, reproductive organs, and then just your rectum. That's it. So everything else is the abdominal cavity, okay? So sometimes it's easy to remember what the pelvic cavity is, just bladder, reproductive organs, rectum, and then any other organ is the abdominal cavity. So that's kind of the easy way to remember that. So again, when we talk about these cavities, they're just breaking them up into which ones were ventral and dorsal. We already talked about that. But when we talk about these cavities, we're also going to talk about these serous membrane cavities that are within these cavities, okay? So all of these cavities, the pericardial cavity, the pleural cavity, are within this thoracic cavity. And then we're going to talk about the peritoneal cavity that's within the abdominal cavity, okay? So just as kind of a clinical application, whereas the pelvic bones provide like some limited protection to the pelvic cavity. So again, you've got a little bit of bony protection to the pelvic cavity. For the abdominal cavity, there's nothing but really soft tissue, so muscle, okay? So the organs in the abdominal cavity are much more vulnerable to trauma. And so obviously this is an issue in terms of if you're, working in an ER and someone was in a car accident, you're much more likely to have damage to those abdominal organs, okay? So let's talk about these crazy serous membranes that create these other confusing cavities, right? That we call like the pleura, and we call the pleural cavity, and we call the pericardial cavity and the peritoneum cavity. So these ones I actually am going to go over kind of twice. You'll get it now and you'll get it in the integumentary system. And I do that because I do think that most students find this confusing. So the serosa are basically these double layered membranes that cover the surface of some ventral body cavity. So either, it's going to be lining around the lungs or around the heart, or it's going to be lining around all the abdominal organs. So we're going to talk about these different serosa. And when we talk about these different serosa, whether or not it be, again, like I talked about, the pleura serosa, the pericardial serosa, and the peritoneal serosa, which again, I'm going to talk about in just a minute if you don't know where those are. But there are 3 different types of serosa. We're going to use the terms parietal and visceral with them. Parietal is going to be, because it's a double layer membrane, it's going to be the inner lining of that double layer of membrane, or sorry, the outer lining of that double layer of membrane, and then the viscera is going to be the inner lining. That's going to be directly against the organs. So, and then there's going to be serous fluid in between. Let me just show you what this looks like, and then I'll actually get into what this is. So basically what happens is you have these organs like your heart, like your lungs, that are constantly moving, right? And they're made of soft tissue. And as they move, and I'm gonna just bring back my camera for just a minute here. But as those organs move, right? So as your heart's contracting, okay, within its cavity, you don't want it to be rubbing up and creating friction, right? On the heart tissue itself, on the outer heart tissue itself, as it's beating in, again, that chest cavity. So you don't want it like rubbing up against your sternum. That would be really bad, right? If the heart was like constantly rubbing up every time it contracted against your sternum and against some of your ribs, then it would eventually cause damage just due to friction. And so what we do is to protect things like the heart and the lungs and the abdominal organs as they have to contract and move, is we have this double lining of a membrane that surrounds things like your heart and your lungs. And in between that double lining, okay, so again, you'll have an inner layer of the membrane and an outer layer of the membrane surrounding like the heart. In between here, you have this nice lubricating fluid, kind of gelatinous, jelly-like, inside, called serous fluid. And that serous fluid kind of cushions, right, the heart as it contracts. So let me go ahead and take away my camera here for a minute so you can see this. If you can picture your fist being the heart, and then this balloon being the serous membranes, and you punch your fist into this balloon, okay? This balloon now becomes the serous membranes, okay? The outer layer of this balloon is going to be the parietal layer, okay? And then the inner layer, directly right up against the heart, is going to be the visceral layer. And that's because we call this layer the visceral layer, because it's right up against the viscera, the organ. So again, this is another term you really want to get in your head, viscera. Viscera means organs. And I always used to joke with my students, especially in marine biology when I teach it, when we talk about visceral mass being, again, a bunch of organs. I always tell the students, I don't like to eat visceral mass because it's organs. So like when you're talking about eating things like escargot, you're mostly eating visceral mass. You're eating the organs of the snail, or, you know, you're eating something like, if you're eating sea urchins, you know, you're mostly eating visceral mass. You're eating organs. And so if that helps you to remember the term viscera, then great. Not that I have anything against eating, you know, you can eat escargot and urchins, and I know there are a lot of people that like those. I just personally, you know, I'm not a visceral mass kind of person. So again, maybe that story will help you remember viscera. So again, when we talk about these double membranes, basically, and now let's talk about the one that directly goes around the heart. So we give it the name, the pericardium. So this whole thing that goes around the heart, this double membrane and the fluid in between, the whole thing is called the pericardium, okay? So again, the outer layer in this case is going to be called the parietal pericardium, okay? Because it's the outer layer. The inner layer, that's going to be right up against, as it folds back on itself and is right up against the heart, that's going to be the visceral pericardium, okay? So this is the visceral pericardium, this inner layer here. And then in between here is going to be called the pericardial cavity. So this space in between the visceral and the parietal layer is called, again, the pericardial cavity. In the lungs, it'll be called the pleural cavity, and in the abdomen, it's going to be called the peritoneal cavity. But in this case, specific for the lungs, it's the pericardial cavity. So that is going to be filled with that serous fluid, that's gelatinous fluid. So as the heart contracts, right, you can see it just pushes against this nice, soft, gelatinous fluid, and that really protects the heart from damage, from friction as it contracts. So pretty cool, right? I mean, again, these are things where I'm like, it's just amazing, like that your body, has this all on its own. Like it's so smart. Like, I don't think I could have designed it any better than that. So these are those things, those aha moments where you're like, our anatomy is just amazing, really. It's just fascinating. So when we talk about, okay, so we have the double membrane that goes around the heart. That's called the pericardium. The double membrane that surrounds each lung is going to be called the pleura, or pleurae for, again, the plural if you're talking about both lungs. But again, there's just a pleura around each lung, okay? That's the double membrane around the lungs. And then the peritoneum is going to be that membrane that's going to surround all those abdominal digestive organs. And you may say, well, why are your digestive organs? They're not moving that much. Actually, they are. Think about your stomach has to churn, right? To churn up all that food that comes into it. Again, your esophagus is going to have to do these contractions, these peristaltic contractions to push the food down in. So actually your abdominal organs are moving inside the abdominal cavity. And so you need to protect those as well. So we already talked about the pericardial cavity. We talked about the parietal pericardium, the visceral pericardium, and the pericardial space with a serous fluid in between. Now we're going to talk about the pleura. And so again, this is going to be this double membrane that is going to surround each of these lungs. And you're going to have, again, a parietal pleura and then a visceral pleural. It's not really depicted well. Let me see if I can find it. Here we go. So here's each of your lungs, right? Okay. And so again, we have this double membrane that surrounds this. This is the pleura. Now, the outer layer here, okay, is going to be called the parietal pleura. The inner layer that's right up against the lungs is going to be called the visceral pleura. And then this space in between is going to be called the pleural cavity. Okay, and again, it's going to be filled with serous fluid. So again, you picture this just like here. This inner layer is going to be the visceral pleura. Okay, the outer layer, just like here, is going to be that parietal pleura, and then here is that pleural cavity with the serous fluid in between. Okay. So again, if you need more, if I'm going through this too quickly for you, please set up some time with me and I will be happy to go over this with you. Now, lastly, we have the peritoneum. So remember, the peritoneum is just going to be this double lining that is going to surround your abdominal organs, okay? And so just like all of the other cavities, there's going to be a parietal and a visceral layer, okay? So here, right up against the abdominal organs is going to be the visceral peritoneum, right? Then there's going to be a space in between. That's going to be the peritoneal cavity that has all the serous fluid. That's going to be in white here. And then this outer layer is going to be the parietal peritoneum. And again, that is, again, going to be that outer layer farthest from the organs, okay? Now, what's interesting here is you can see why the kidneys are oftentimes vulnerable. Like when you talk about someone hitting you in the back and it could potentially bruise your kidneys. You can see why now, because the kidneys are what we call retroperitoneal. They're outside of this double membrane with a serous fluid. So they don't have that extra protection of the peritoneal lining. So that's why the kidneys are actually more vulnerable. And retroperitoneal means they're literally outside or behind the peritoneum. So kind of interesting fact for you there. You'll get into that when you get into 202. Okay, so those are all those terms. Please let me know if you have any trouble with those terms. Now, just as kind of a clinical application, those serous membranes can actually become inflamed due to infections or some type of other inflammatory cause, and that can cause pain. So you can get things like peritonitis, or you can get pleurisy. And what ends up happening is those nice, typically very smooth layers end up becoming rough because of the inflammation, and they can actually stick together, and it actually is really, really painful from what I've been told. So those are just kind of a clinical application of those membranes. Now, lastly, we can break up the abdomen into different quadrants and regions. So the one that I have used most frequently is breaking up the abdominopelvic cavity into these 4 regions. And you do that based on kind of, if you could picture the umbilicus here, so the belly button, the umbilicus here, and you draw a line straight across and then a line down the midline. And that makes your 4 cavities, okay? Remember that this is on the patient, not on you. So this is their right upper quadrant. So the RUQ means right upper quadrant, left upper quadrant, left lower quadrant, LLQ, and right lower quadrant. When I did my EMT course, this is what you're going to reference. And so if, someone took a blow to the right upper quadrant, it's kind of important to know what's in this right upper quadrant. So if you know that the liver's here and the gallbladder's here, those are kind of things that you want to make sure, if someone was in a car accident, that their liver is okay. It's a pretty important organ, that their gallbladder is okay. And then you have some of the intestines here. Now, in your left upper quadrant, you have the stomach here. And I always tell my 2 kids, they're lucky for anatomy purposes in that they both have G tubes. So they actually have a port. They're actually fed a specialized formula directly into their stomach. So they have a little port here that's called a G tube or gastric tube, and it goes directly into their stomach. So for them, it's on their left side. So they can always remember that, their stomach is on the left side because that's where their port is, on the left side. So stomach, maybe that story will help you remember that the stomach is what's in the left upper quadrant. And it's good to just kind of know these terms, especially if you're working in a hospital or working in any type of emergency medical situation. And then here, the left lower quadrant is going to be mostly intestines. And then, even lower down here, you have things like the urinary bladder and some reproductive organs. And then on the right lower quadrant, it's important to know that you have this little structure right here. So you have the colon here, and you've got the colon, and then what's called the cecum. You'll learn that in 202. But more importantly for you now is that it has the appendix here. So if someone comes in complaining of pain in their right lower quadrant, then you might think about appendicitis. So again, those are just some of the major. Right now, I just want you to know the really major organs: right upper quadrant, liver, gallbladder, some of the intestine. Left upper quadrant, stomach, some intestine. Again, left lower quadrant is mostly just intestine. And then the right lower quadrant, again, is where you're going to have some large intestine with appendix. So appendix is your difference here in the right lower quadrant. So that's basically, I want you to know about that. You can break up the abdominopelvic quadrants into these 9 different regions. You do not need to know this for me, but just in case, maybe they use them in your hospital, maybe they don't, then you can refer to these different regions. Again, I'm not going to break, it is a little bit more detailed to break it up into these 9 different regions, but I just haven't really heard them. If for some reason you hear them out in the hospitals and they're using them, please let me know. But I just feel like they don't really use them much right now, so I'm not gonna have you responsible for them. But I am gonna leave this light in here just in case maybe for some reason your 202 instructor says, hey, actually they are using them and you should know them. But for right now, again, you don't need to know them for my exam. There are some other body cavities, obviously your oral cavity. You have digestive cavities inside your digestive organs, like there's cavity inside your stomach, obviously, inside your intestines. Nasal cavity inside your nasal passages. Orbital cavity, again, where your eyes are, that space where your eyes are. middle ear cavities inside the middle ear, and we'll get to that towards the end of the semester. And then you do have a cavity that's not exposed to the environment at all, and that's your synovial cavities. That's going to be your synovial joint cavities, and they're completely enclosed. Okay, that's important to know because if for some reason you get an infection in the synovial cavity, I know someone that this just happened to, and it is really a hassle to treat because it's very difficult to get, antibiotics and things into those cavities. So it's also very difficult to get infections in them. But if you have surgery, on that area for some reason, then you can get an infection in your joint cavity, and it becomes a real challenge to treat. Okay, so that's it for that lecture. If you have any questions, I know I went through that quickly, please feel free to email me or set up a time with me, and I am happy to go over this with you.